All right, so I'm going to turn it over to Michelle now, and she's going to share a little bit about their lean visual boards. And hopefully, Michelle, you have the ability to share your screen if you wanted to share your PowerPoint, or
Yeah.
I'm happy to share for you, either way.
Okay, do you see my board?
I can, thank you.
Okay. All right, so I wanted to talk a little bit about our lean visual boards today that we've been working on this year. And I definitely want to start by acknowledging and thanking Mike DeLuca from Toric Consulting, Anderson Valley Health Center, and Hank at NCCN for just the resources and the support to start understanding more about lean in the last year and some of the tools like the visual boards that we could use. So kind of the journey began a little bit with Anderson Valley, where we knew they were working with Mike DeLuca, who was coming on site doing consulting, and I was able to join them one day and was just really impressed with how he's kind of working with the groups, and they were starting to do some of these lean visual boards, and a big part of it was just kind of walking around the clinic to say, where should we put the board for this team and things like that. So that kind of started the process, and then Hank and CCN really picked up this, and I'm not sure how many of us were at the Rural Roundtable in March, which seems forever ago. Melanie and Trisha did a great presentation on lean visual boards. And so several of our staff were there, and that kind of got us motivated to come back and start on this process. So I want to just very quickly show a couple, and a few of these slides are from Mike and Hank, which I'll acknowledge too, and then some of them are our own. So just at a very high level, lean is a way of thinking and behaving. It's not an acronym. It's kind of focused around respect for people with a focus on the process and the workflows, and really looking at the process instead of, and how it's done. I'm really looking for improving quality and improving efficiency, removing waste, and how we can kind of generate value. And so Mike's simple definition is that when you're thinking of value, that you're really thinking of value for the customer, the patient, and that you do really focus on respect for people. And that two important habits that come out of lean are the improvement and the coaching. And so as we started doing some of the initial coaching with Mike and Hank, it was interesting for us to see, like, where do we start? Where do we start with like bringing these lean concepts to the health center? And how can we do it where we can involve everybody at the health center? Not just like one initial idea was, oh, we really want to look at our referral process. So let's start drilling down and using some tools to identify referrals. But that really was just a small number of people involved with that process. So we kind of decided that what we were going to do was just start off with something that was more broad that everyone could use. And so that kind of idea for us became these lean visual management boards. And so we saw these as a tool to empower our team to learn more about lean principles, to be able for each team to have kind of a board in their area that they could use to help improve communication and workflow, especially during a year with so much change coming down. And that these boards were also something that we actually had a little control over at a time when we had very little control over things, because people could design them for how they wanted to use them. And so that was really a big part of it, was to talk about, you know, like, this is your board. You can do whatever you want to with it, you know, like make it useful for you. And so we had a couple different sessions with Mike where it was mostly the QI committee, which is supervisors, and kind of talked a little bit about the overview of what these boards are and what they could do so that they help us with our workflows and, provide direction, but that the goal is to make it very easy, a visual system that makes it just quick and easy and available to everyone. And we did, I think, 4 different sessions over 4 months where we kind of looked at some overall slides, but then we started drilling down to each department and kind of how we were going to do those. And then during the 4 sessions, we sent photos back and forth to him, and then we kind of started drilling down on how we could improve those. So I'm going to show a couple examples. This is actually from Hank and NCCN's presentation, the Rural Roundtable, of just kind of a sample layout of some things you might consider including for a frontline board. Just, your plan for the day, acknowledgements, what metrics do you want to check, what kind of projects are you working on, and then a sample layout potentially for like an executive or director level that might include things like care team routing or leader standard work, or just starting to see, what you might use. So I'm going to kind of show an example of several different boards from our departments, and then I'm going to drill down on our dental board because we really use them as an example each month to continually improve on. But the first board that we started off with was this behavioral health team visual board. And so this was a great one to start. The team decided to place it on the wall to the right of our staff room door. And so almost everyone that came in to get the fridge or fill up their water glass or something like that, it was right there for them to see. And this is just such a great colorful, artistic group, and it just showed on their board. They really came up right away with some of the key things that we talked about was to kind of have these news and announcements. They always had these great quotes that just really were just inspirational that you could kind of see when you went into the lunchroom. They showed, their to-do, doing, and done, which was kind of a theme across the boards, kind of a recommendation for that. And also just started with some basic metrics, like they mostly wanted to see how many new patients they had. And there's 4 behavioral health providers. So as we started to work on this, they decided that each one of them would take a week of the month. And so during their week, they can come and change the board whatever way they want. So they would change the announcements, change the quote. We kind of trained them all on how to look up their new patients and no-shows so that they could update the board themselves with their statistics. So that was the first one. Then the next one was our health information team visual board. So this is kind of they're all work in progresses. And that's what we really try to encourage everybody is to say, just start. We ordered 10 boards with pens for every department and kind of worked with our handy person to make sure that they were mounted in a good place. And so, and then we just said, just start and we can, you're going to keep working on it. So they have just kind of a lot of different stickies right now, but their real focus initially was just on changes. Like, what are these changes that are happening and what are we doing? And so that was kind of the main thing for them. And then also kind of looking ahead in terms of what are some upcoming plans. We've worked together to maybe talk about adding a referral section on this board that might have some metrics on how many referrals are open or things like that. So those are some ideas that we have for the health information team. This is my board for CQI. Couldn't get a good picture without the glare. But, really just these last couple months was kind of focusing on the partnership measures. It's a little hard to kind of see the section, but on the metrics on the left, there's kind of a stoplight report that shows which measures that we've already met, are close to meeting, or haven't met. And so we already know we're not going to meet childhood immunizations, but we just in the last few weeks are about 5 patients ahead on hypertension. So we're feeling pretty confident about that measure and wanted to kind of put that out there. And then you can see on the graphs on the right, those are kind of the graphs of the measures since July. And the right two are advanced care planning discussions and forms. So that has just been skyrocketing over the last couple months. And so just really giving thanks to the providers and the nursing team that have been working on that. Our patient representatives, our service team, they're the most recent board. And so I think everyone's really now like wants to get colorful. Like, that's been seen. And it's a great start. So like little art, our behavioral health teams are doing a lot of art therapy lately. So we've been kind of encouraging you to use it on your boards. So they have kind of started with really wanting to see what they're to do, doing, and done, and realizing that a lot of times it's great when you can check something off and put it on the done list. But the reality is for all of us, a lot of these things are just ongoing. You're just always doing them. So, I like how they kind of took this to do and then are just saying like, we're just keep on working on this, and so that's something that I think has been great. And then, news, we've had some new people and stuff. So they also have these team huddles that they've started doing recently, and they do huddle in a room where this board is, so they can use it. I think that is happening with some teams, but not all teams. So we found that it's really kind of been really effective if you do have a regular, even if it's not daily huddle, that you can use the boards. And then on a kind of completely different note, our grant writer has been working really hard on developing this amazing Trello virtual board. And so we wanted to acknowledge the work that she's done. So it's very different. But we did in one of the sessions with Mike kind of bring this up and talk a little bit about how you can use some of these other types of tools instead of a physical whiteboard in your space for organizing. So at first, for a few teams did their boards, but not everyone had done them yet. So the month meetings really helped people to think about, okay, oh yeah, maybe I should try to get it done by that next meeting. And then those that had started their boards were kind of starting to figure out how they could maybe improve them. So these were some questions that Mike gave us about what we should think about. How are we using these boards? How often are we updating them? How are we using them? Is it in a huddle? People walking by? Are the boards like triggering us to action? Is it not just news and acknowledgement, but is there something on there that actually is empowering us to make a change or to do something? Are there metrics on the boards? Are they helpful? Who's updating the board? And then most of all, how does it benefit us, our patients, our staff, the clinic overall? What's the payoff? So we did a drill down on our dental board several different times. And so this was kind of one of their initial boards and during our session with Mike, we kind of looked at the overall layout similar to the others where we had our project-based work, our metrics and our calendars, but he would kind of did these drill downs where he focused in on certain parts of the board, and then the purpose of this section and these notes we actually were typing during the session. So as we were talking, he was writing these things up, and then he would send us the afterwards. So we kind of looked in at the actual sticky notes and just said, it wasn't always clear about who might be involved with this work, and when it was due, or if there were any special notes. So, he recommended that maybe we on the stickies add a date or target date or who's owner. And then a big one is, how do we break these down into milestones? Because you can put a to-do on there that's, a huge process. And so how do you actually kind of break down the project with your sticky notes? So that was something that we kind of figured out, talked about how we might be able to do that on the boards. We also kind of just looked at the communication area, and, just was kind of looking at they are doing a combination of, new staff and thank yous. Having the pens on the board has been great, because in this area, they're really encouraging everybody on the team to update this section. So even though someone might be responsible for other sections of the board, they really want to encourage everyone to write on the board. And I think that is great. The dental manager is really rocking the metrics section. She definitely has more metrics than any of the other teams at this time. And so this was also something that really evolved over the 4 months. At first, they were looking just at no-shows, or not, shouldn't say just, but at no-shows. And then really decided they wanted to break out. We track rescheduled late and canceled late. We have a special status for that. So they decided to start looking at that, and found some really fascinating things about certain types of visits that were the ones that were always being canceled late or rescheduled late. And so, really we're looking at a lot of these. And so there was some notes that we talked about. It's like setting a target, or trying to look at it over time. Is there a way, what's the reference for the data, And then these were just some general comments that over the couple months that they did to kind of help improve the board. So there are, some of the things that we already talked about. But, they shifted their metrics. They focused on certain things. They added some trends. And they felt like the payoff was that the whole team was more informed, that their communication was better, and that people felt acknowledged, and they really appreciated that. This board is in their staff room where people eat lunch, and they had been huddling around it until they now are kind of doing more remote huddling through Zoom. But I think this has come a long way, and I'm seeing similar changes happen with all the other teams. So one of the areas that's been the most challenging has been prioritizing data and measures for the board. And so this was a slide from Hank at the Rural Roundtable, which I really liked. It just, we all have so many projects and so many measures. And so you don't want really, in my opinion, to clutter the board too much, so that if there's just so much on it, it's not useful. So how do you kind of just pick the key things? And so I did like this kind of idea about looking at effort and value. So, the high value, low effort, do it now, maybe that's something that's a good project to start working on. If it's a high value or high effort, what part of it could you start doing now? And if it's kind of low value, even though it's low effort, is that something you want to prioritize on now? So I like that slide. Then, I just wanted to say how quality is everyone's responsibility. I feel like this has been a really great way to get our teams learning about lean. And in 2021, we're hoping to start looking at a few more individual processes and some of the other lean tools. But I feel like this was a really good way to start. And our nursing team is putting together a board right now, our admin team. And yeah. So it's been great. And I must say, I was kind of daunted when it first started because, especially for QI, I think someone said about the different language you feel like you're speaking sometimes. It was like, okay, how are we going to get this started? And especially around metrics, I kind of struggle about like, what data do you want to look at? You know, I offer to help put together graphs or things, but a lot of times when, you know, people aren't really sure what they want to see. And so I think this has helped just really people starting to use the boards and say, what information is it that I want to see? What do I want to share? And I think that the lean boards has kind of helped this process for us. So I'd love to open it up for any questions or comments.
That's great. Thank you. The boards are just beautiful, and I love how each has sort of its own kind of unique characteristics based on the team that's building it. I think that's really neat. It looks like Trisha chatted in a question for you. Does the leadership team round check in on these boards?
Not yet. So with the dental board, I actually went over to a couple huddles to see like how they were using the board. And I was there in one of the huddles where the team manager was talking about adding the dates and people. And so we were actually talking through that process and adding that. Yeah, and I had also, well, I guess actually a little bit more. The patient supervisors board too. This one here. I was just at the, you know, it was at one of their first huddles where they had done this, and we're just kind of talking about what other information they were interested in, and they wanted to know more about, was there a way to keep track of copays and how many copays had been done in a day? And so I think it helped kind of bring up some conversations about how we could get more information about these projects.
Great.
But I do want to acknowledge that I think Marcelle, if she chimes in, that they do have a more robust leadership rounding with their lean boards at Anderson Valley.
Yeah, this is Marcelle. So I love your boards. Those are beautiful, especially that behavioral health board. It makes me think, yeah, we could get a little bit more artistic. So each of our departments, we have a weekly improvement huddle, you know, separate from our daily huddles focused on patient care. But so we have our improvement huddle. And those are all done around the board, except for behavioral right now, which is completely virtual. And we do have somebody from admin or leadership attending each one of those, just in the capacity of, you know, what's going on, what are your needs right now, and how can we support your needs. It is not in, you know, the teams, they lead their own huddles. And admin is there, you know, purely as a, you know, we just want to know what's going on with you and what your needs are. We did, prior to COVID, have once a month an all-staff rounds where we would get the entire staff and walk around and just do a very brief, each team give an update at their board on what their department was doing. But, you know, we haven't done that since COVID.
Right. Other questions for Michelle?
Hey, Michelle, this is Tim from NCCN. As everybody mentioned, awesome boards. Thanks for sharing it and spending the time. One of my curiosities is, I think Marcel and Chloe had brought it up at the roundtable where they had the visual boards that other staff from other departments would swing by and take a look and stop and drink some coffee or tea and just check out the board for a little bit. And it seemed to bring a little bit more unity of, oh, that's why those guys are doing that. And so there was almost a clearer understanding across all the different departments. How's the reception been from your executive team or other departments when looking at your boards?
I think it's been good, and a lot it has been kind of on location. I think the boards that are the most visible to everybody are this behavioral health team board and the quality board, which is by the water cooler. And so, but I think a big part of that is kind of that location where it's, you see it, but I agree, I'll see them stopping and looking and going, oh, right, that Calming the Chaos support group is, or, reading the quotes. So yeah, I think part of it is encouraging, but I love that idea when it's, kind of safer to having everybody walk around. But one thing I did do was when we were just kind of promoting the boards and trying to encourage everybody at an all staff, part of these slides are from a presentation I did at the all staff highlighting other teams' boards. And I think that really helped to motivate because within the next few weeks, patient services had a board and nursing's was up and going. So yeah, I think when other people, not only are they in sharing and seeing what other people are doing, but it's motivating them to create their own.
Yeah, great. I appreciate that. I start to think about like front desk staff that may or not always feel that they're a part of all these teams that are doing the clinical work behind the scenes, but then realizing how significant they are, whether it's their outreach, their phone calls, or even just the communication coming in. So very cool. Thank you.
Well, and I like the idea that these boards are starting to spark ideas around specific QI projects, that as you put things in front of people, it makes them ask questions, right? Which is such an important part of this process. And then that's leading to maybe another project idea or idea of what other data they want to look at. I think that's a great sort of example of the learning that can happen with this. Sadie is asking if it's possible for us to share your slide presentation with the group. So Michelle, are you comfortable if I send this out to everyone afterwards?
Yeah, definitely. And I also wanted to encourage you to send out the email that you sent out after the Rural Roundtable, because I know that there were a couple attachments you had. It was an email from, I want to say it was like March 16th or something like that.
Mm-hmm.
Because one of the things that I felt was really helpful when we were at the roundtable was kind of some of the preparation sheets of like, what would you want to put on your board, and people kind of drawing those out and talking about them as a group, because I think that that's really important work.
That's a great suggestion. We'd be happy to send out those resources that we shared following that workshop. Great idea. All right. Well, Michelle, thank you so much. This is awesome and great work, and so glad to see your teams getting creative and engaged in that way. So we look forward to hearing more later on.
Okay, thanks so much.